Introduction to the healthcare system. Ethics. Anyone who works with patients or medical records needs to know some important ethical and legal issues. You will learn about patient rights and responsibilities. You will also learn about HIPAA, an important law that protects patient privacy. You also know that one of your responsibilities is to keep patient information private and secure. Protecting patient information is very important. If you are ever unsure about how to handle patient information, ask a supervisor. Patients have rights. So what is the patient's Bill of Rights and Responsibilities? In 1997, a presidential commission created the Patient's Bill of Rights and Responsibilities. The Patient Bill of Rights helps ensure quality health care. It also protects patients and healthcare workers. They also give a way for patients to address problems with the healthcare system. What are a patient's rights? According to the Consumer Bill of Rights and Responsibilities, patients have a right to accurate and easy to understand information about their health and healthcare providers. If a patient speaks another language, have a physical or mental disability, or don't understand something, assistance must be provided so they can make informed healthcare decisions. Choose providers and plans that provide access to high-quality healthcare. Emergency services whenever and wherever needed without prior authorization or financial penalty. Know their treatment options and make decisions about their care. If patients cannot make their own decisions, parents, guardians, family members, or other designated individuals can represent them. Respect and non-discriminatory care from healthcare providers and health plan administrators. Private and protected health information. This means that patients have the right to talk privately with a doctor and that only people involved with their health care can see their medical records. Patients also have the right to review and copy their medical records and ask that their records be changed if they are not correct or complete. Complain about healthcare or anything they feel dissatisfied with, such as wait times, operating hours, the conduct of healthcare personnel, or the quality of healthcare facilities. Patients also have a right to a fair, fast, and objective review of any complaint against their health plan, doctors, hospitals, or other healthcare personnel. Patients not only have rights, but they also have responsibilities. According to the Consumer Bill of Rights and Responsibilities, patients must be responsible for their own health, maximize healthy habits such as exercising, not smoking, and eating a healthy diet, prevent the spread of their disease, work with healthcare providers to make healthcare decisions and carry out upon treatment plans. Understand the risks and limits of the science of medical care and that healthcare professionals can make mistakes. Provide information about their health and let healthcare provider know what they want and need. They must also report wrongdoing or fraud to the appropriate people or legal authorities. Be financially and administratively responsible. Make a good faith effort to meet financial obligations. Be knowledgeable about his or her health plan coverage and health plan options when available, including all covered benefits, limitations and exclusions, rules regarding use of network providers, coverage and referral rules, appropriate processes to secure additional information, and the process to appeal coverage decisions. Follow administrative procedures of health plans, healthcare providers, and governmental health benefit programs. Be respectful to others. Show respect for other patients and healthcare workers. Be aware of a healthcare provider's obligation to be reasonably efficient and equitable in providing care to other patients and the community. HIPAA regulations. What is HIPAA? When a patient gets care, they may see doctors, nurses, and other healthcare providers in several different clinics. Patient medical records and billing information is often moved from place to place or from computer to computer. Because private information about patients can be in many places, it is important to have a way to protect health information and keep it private. The Health Insurance Portability and Accountability Act was a law created in 1996 to protect patient privacy. HIPAA privacy rules set limits on who has the right to use patients' written, spoken, or electronic health information. It also describes how healthcare organizations and insurance providers must protect health information, including how to handle protected health information, how to share information, what type of information can be shared, with whom they can share information. What if HIPAA rules are violated? Breaking HIPAA rules can result in fines or prison terms. For accidental violations, an organization can be fined $100 for time a person's health information is not protected. When someone knows they are violating HIPAA rules, fines can be up to $250,000 with a prison term. HIPAA violations may also harm an organization's image and their ability to get grants. The organization you work for may also have rules about how they punish HIPAA violations. Who needs to follow HIPAA rules? Not every organization is subject to HIPAA rules. Many other organizations follow different or less strict rules for protecting protected health information. So who needs to follow HIPAA? Healthcare providers, doctors, clinics, hospitals, psychologists, chiropractors, nursing homes, pharmacies, and dentists. Health insurers, health insurance companies, HMOs, company health plans, government programs such as Medicare and Medicaid. Check to see if your organization is subject to HIPAA rules. So public health information in your work setting may be written, spoken, or electronic. Examples of public health information include clinic notes, lab results, or treatment records in a medical record, voice messages left on a patient's answering machine to confirm an appointment, conversations about patients between doctors or nurses, doctors' recorded voice transcripts of a patient's clinic visit, filled prescription bottles, pictures of patients on a public website. How is protected health information kept private and secure? There are several things you can do to protect the privacy and security of protected health information. Follow these guidelines when working with protected health information. Use and only give the minimum information needed. If in doubt about giving information, get patient authorization, and keep protected health information secure.